prayer personally and quietly for all the people that have suffered and are enduring the aftermath of the hurricane. I personally looked at the pictures on television of the Bahamas and cannot imagine anybody surviving it through that torrent of wind and rain and everything. So let's give in our own hearts a personal prayer for them for the moment. Thank you. When, as a faith community, you look into the scriptures to talk about PTO, you won't find anything. All right? It doesn't talk in that language. But if you do look carefully, you will find deep message that endorses from the faith perspective why it is right, not just appropriate, why it is right to have the PTO that people can use in an appropriate manner towards taking care of their health and that of their family. So let me share with you from Deuteronomy chapter 15 a few just quick verses. There shall be no needy among you, if only you heed the Lord your God and take care to keep all this instruction that I enjoin upon you this day. It sounds like there won't be any needy people in the world. But if you go a little further, it says, if, however, there is a needy person among you, among your kinsmen, do not harden your heart and shut your hand against your needy kinsman. In the next verse, rather you must open your hand, for there will never cease to be needy ones in your land, which is why I command you, open your hand to the poor and needy kinsmen in your land. That language echoes Exodus. It echoes Pharaoh's hard-heartedness. And thus we understand there will always be people in need. There will always be people that require us to labor for social justice on their behalf, and particularly this morning on the issue of PTO. And if that's not enough from Deuteronomy, then I would suggest we listen to the words of Isaiah. No, this is the fast I have chosen, to break open the ties of evil, to undo the straps of the yoke, to let the crust grow free, and to undo every yoke. Is it not to share your bread with the hungry, to bring the homeless poor into your houses, and when you see those who are naked, to cover them, and not to ignore your own flesh? And his contemporary Amos said, this is what the Holy One has said, for 3 transgressions of Israel, for 4 I will not call back the punishment, because they have sold the righteous for silver, and the poor for a pair of sandals. They trample the heads of the poor into the dust, and pervert the course of the humble. It is clear from the message of Scripture that we can focus, and we should, and we must, to bring justice on these matters, because that is what our faith calls us to do. Regardless of our particular theology, faith calls us to do justice. So I close with a very quick little story from the rabbinic lore. And once there was a man who came to a person who came to a rich man and asked him to give charity. And the rich man didn't want to do it. So the rabbi went to the rich man, come look through the window. What do you see? And he said, I saw people, lots of people. And then the rabbi said to him, come, look at the mirror. And what do you see? And he said, I see only myself. What's the difference between the window and the mirror? One is clear and nothing behind it. At least in those days, it was covered in the back with silver. For those who would not see the compelling case of social justice, for paid time off to enable people to take care of their health and those of others, I wonder what the back of their glass is covered with. Thank you.
Good morning. I'm Kim Bobo, the Executive Director of the Virginia Interfaith Center for Public Policy. My sons are grown now, but I remember the excitement of sending my children back to school, get them out of my hair. I also remember that soon thereafter, one of them would get sick, and my husband and I would have the conversation, who's gonna stay home? Luckily, we could take turns because we had paid sick days. Every parent and every worker need paid sick days, which is why 145 nations guarantee paid sick days. We don't yet have a standard in the United States. which is why states like Virginia are taking the lead. Today, the Virginia Interfaith Center for Public Policy, the state's largest faith-based advocacy organization, is launching its campaign to establish a paid sick day standard in Virginia. The Virginia Interfaith Center has chosen paid sick days as its top legislative priority because it is a clear moral issue helping families and low-wage workers. It helps businesses and schools and the overall public health. It would help lots of Virginians. 1.2 million Virginians have no paid sick days. And it's a common sense approach to a very serious problem. We believe we can find a Virginia way to create paid sick days. So today you will hear from our legislative sponsors, a former teacher and leader of a teachers union, as well as a board member and our staff leader on the issue. I needed paid sick days when my kids were young. I need them now. One of our reporters is not here today because she's covering the Legionella outbreak in one of the Chesterfield schools. Again, those parents need paid sick days. So too do all Virginians. So I would now like to invite Mr. Tom Calhoun, who is head of an AFT local and a former teacher, to talk to us about why teachers need paid sick days. And then we will hear from the two best legislative champions you could possibly have in the Virginia General Assembly to tell us about the bill and why they're leading the cause.
Good morning.
Good morning.
I'd like to thank our two senators and delegates for sponsoring this all-important bill. I was talking to another delegate only yesterday, and they was saying they would be happy to help out. So you all need some signers. I can tell you a couple of people because they understand how important this bill is. And I said I would certainly ask Kim if she needed some more sponsors because they are on board for this. And I also like to say that, you know, as happy as we are that Virginia is the #1 state in the country for business, I think we're number 50 for workers. And it's because of things like not having paid time off. So in the school, when I was teaching, I taught elementary school, so you might be surprised. Back then, there were very few men in the elementary schools. As a matter of fact, many years I was the only man teacher. A couple of years there was a PE teacher there, there was a man, and custodian. But anyway, I taught elementary schools, grades 2nd through 4. Did some time in pre-K, kindergarten. I learned early to keep plenty of these boxes of tissue. I learned that early because if not, the kids would ask you every 2 seconds, could they go to the bathroom to get a tissue? So, okay, we'll solve that problem. So I started buying tissue. And I kept them by the box load in my closet because the students came to work sick. And you would ask them, they would walk in the door and put their head on the desk. And again, I'm in elementary school, so I'm like, what's wrong? They don't feel good. And so you're gonna ask them, why you come to school? Because mom had to go to work. Can't get off. They didn't have paid time off. And you'd also run into this issue again during the day. Student gets sick in school, and we get out our list in the classroom and call mom at work, and they can't come pick them up because they can't to the nurse's office. And that's where they stay the rest of the day until the parent can come get them. It was a way of life. It is a way of life when you teach in school, and that's why we kept so many boxes of tissues in our room. The kids knew on my desk, just get up, go get a tissue, go back and sit down. But I've had everything occur in school, every type of situation of these students who come to work sick, come to school sick, have to stay at school sick because the parent cannot stay home and cannot leave work to come get them because they just don't have paid time off. And that's how I ended up in this conversation with Kim, and that's how I ended up here telling her about the tissues. I knew everywhere tissues were on sale. I knew which box of tissues had the most tissues in it. Kleenex is great, but they don't have as many tissues as some of the lower price brand. I was a tissue expert in my 17 years in the classroom. So we really need to do something about this, and there really are General Assembly members lining up to get this done. So I hope that Virginia takes this step toward maybe being number one for workers and number one for businesses, where I would like to see the state be. There have been states that have been both. It is possible because they're not mutually exclusive. We can be just as good for our workers, parents, students, and if they don't have sick days, they not only send the children to school when they're sick, they go to work when they're sick. So I don't know if they have teachers on their job like I kept in my classroom, but I do know if you have to go to work sick because you can't afford to be off, or send someone to school sick because you can't afford to be off, it affects everybody, period. Thank you.
Thank you. I think you took my remarks.
I'm sorry.
Did you take them to hand?
I'm kidding.
Oh, maybe I have your little.
Oh, they're right here. Sorry. Not that I couldn't recite in my memory, but I may want to check a fact or two. Some of you might actually be recording this. Good morning. I'm State Senator Barbara Favola, and I represent the 31st Senate District, which is in Northern Virginia, large part of Arlington, and I go up the Potomac River. So I'm part of Fairfax and part of Loudoun, three of our most populated jurisdictions in the Commonwealth. And I'm taking this issue on because I believe in my heart that it is absolutely the right thing to do. It is the right thing to do for families, for our teachers, for our students, for our employers, and for all of our employees. There's some very compelling facts that once you hear them, I believe you'll join the cause as well. 1.2 million employees in Virginia have no paid sick days. So these employees go to work, most of them are low-income wage earners, and they are going to work when they're very sick. What this proposal does is it requires an employer with 6 employees or more to grant 5 sick days per year. And if the employee works part-time, then they can accrue up to those 5 sick days based on their hours worked. This, in my mind, makes common sense. It's a public health issue. When you think about the employees who are likely not covered right now and why this bill matters, you have to think about the home care worker who goes to a home every day, probably takes care of an elderly person whose immune system might be compromised, and there that worker is with sniffles and coughs and in very close contact, helping an individual who needs help with personal assistance. I'm sure germs are being spread. Then you also have workers in child care centers. Now they're in contact with our little ones every day, all day. And I venture to say that those folks probably are not getting paid sick days. Well, you know how easy it is to spread germs, a cold or a flu, a virus, especially among young children. A germ could spread throughout a whole classroom or even a school. And restaurant workers, so you and I'll go out to restaurants. I bet there's some restaurant workers, actually those who prepare our food, who are going to work when they shouldn't be. Going to work when they're sick, going to work when they should be staying home and taking care of their cold or sniffles. However, they can't afford to take that day off. I think we can't be penny wise and pound foolish. Did I say that correctly?
You did. Yes, you did.
I think we are better off saying to employers, you need to meet this minimum standard, and it is a minimum. Certainly, employers can do more, but you need to meet this minimum standard, not just for the health of your employees, and this means retention of employees, it means a reduction in recidivism for your employees, and studies have shown it actually means you have a more robust bottom line. In addition to that, it is the right thing to do from a public health standpoint, because others are being exposed to those germs when you, corporations, or you, employers, are not acting responsibly. So that's why I'm standing up to support this bill. And the value of having this language, the language I described earlier, embedded in statute is it really institutionalizes this benefit. So the benefit can't just arbitrarily be removed, during economic downturns or at the whim of the employer. So there's significant advantages to having a law on the books. I think that this is a common sense ask. I do not think this is an excessive burden for businesses. I think many businesses know this is the right thing to do, and I think we just need to coalesce our forces, make this important statement, protect our families, protect our workers, and make Virginia a healthier place. Thank you.
Good morning, I am Delegate Elizabeth Guzman. I represent the 31st District, which includes parts of Prince William and Fauquier counties. And I have joined Virginia Interfaith and Senator Favola. Actually, thank you for your leadership on this issue, but I also believe that lifting up working families is lifting up Virginia. We shouldn't be proud of being the last of working class, as the president of the AFT mentioned, and we have to take Virginia to a different level. As a mother, I know how hard it is to juggle a full-time job and a family. I have 4 children. And when kids get sick and need to go to the doctor, you must see that they get care and have a speedy recovery. However, when you know that going to the doctor will bring less money to the house, it's a tough decision. I remember working in the private sector with little children, and I needed to take a vacation day anytime they had a doctor's appointment. And that's one of the reasons why I went back to work for the public sector, because public employees have always had paid sick days. Sadly, that's not the case for many families in Virginia. There are 1.2 million Virginians that are working without this benefit, who are often forced to use their vacation time to take care for a loved one or visit a doctor themselves. When I thought about this issue, I thought that it was very personal until I decided to run for office and talk to other Virginians who live in my district. And I learned that this is the struggle of many people in my district and in Virginia. I remember one of my constituents mentioning, if there is something that you could do for me, could you get for me paid sick time off? I have 10 days of vacation throughout the year, and I like to save them to use 5 days to spend with my children for a spring break, and 5 days in the summer. I want to spend time with them. However, I'm paying health insurance, I'm thankful for Medicaid, I'm thankful for the Affordable Care Act, but if I don't have the means to the doctor, I'm not gonna use it. So as parents, we work so hard that our children excel in school, but we also need to take care of ourselves. Parental health and well-being are tied to our children's success in school. We need to ensure the parents across the Commonwealth have the time to visit a doctor to get preventive care, have the time to take their children to the doctor, have the time to take their parents to the doctor. Many of us are part of the sandwich generation, and we are caregivers for our elderly parents. Last year, we expanded Medicaid in Virginia and now over 300,000 people have signed up. Now it is our job to ensure these families can utilize that care. This is why I am proud to be sponsoring the Paid Sick Days Act with Senator Favola to ensure that our families have the chance to thrive in Virginia. Thank you.
Thank you to our wonderful speakers. Those were some very moving stories. 85% of voters say that employers should offer paid sick days or paid time off. And as we've traveled around the Commonwealth at Virginia Interfaith Center talking about this issue, we have heard overwhelming support for paid sick days. There is truly incredible momentum around this issue. Almost 1,000 faith leaders have signed our petition. Our members are meeting with their legislators to urge each of them to support paid sick days. Just this past weekend, a group of individuals signed our petition and wrote letters to their legislators after church. Individuals are asking candidates about their positions on paid sick days at candidate forums. We're gathering stories from people who currently cannot take a paid sick day. Our coalition of supporters is growing. This is a critical issue for working families and people of faith across the Commonwealth. As we continue to organize around this issue, we look forward to the 2020 General Assembly session when this legislation will be voted on and we all hope passed. So I will thank you all for coming, and I think if there are any questions, we'd be happy to take those.
Can you say your name real quick?
Oh yeah. I'm Amanda Silcox. I manage our economic justice program work.
This is not the first time this legislation has been introduced here, and I was just wondering if there are any differences between what this bill would require and what previous bills that have required.
Sure, I can answer that. So the first time we introduced this legislation was in 2018. As I mentioned earlier, it was one of the priorities for people who live in my district. Unfortunately, if you look at the voting record, we were not able to find support for individuals across the aisle. You know, the arguments was 40 hours was too much, and in all good faith, I believe him. So I said, okay, I'm thinking about the people who was waiting for this benefit. It's a lot of people. So last legislative session, I said, since we're gonna continue with the same amount, the same membership in the House of Delegates, I wanted to find middle ground so we could find support across the aisle. So this year, at this 2019 legislative session, I reduced it to 24 hours and nothing changed. The arguments were the same. So that's why right now we're going back to the initial, which was 40 hours, and we're hoping that now partnering with Virginia Interfaith and many faith organizations and Senator Favola as well, we're gonna be able to find the support that we couldn't find before. And that is, nothing have changed. We are just hoping for new members that actually believe that taking care of their workers should be a priority.
And I want to add to that, the Virginia Interfaith Center has a history of working bipartisan. We've helped pass several pieces of legislation last year with both Republican and Democratic support that improved conditions for workers and created a pay stub requirement in Virginia. Again, lots of states don't have a pay stub, Virginia. So Virginia was taking the lead. And again, we had bipartisan support for that. We've already been reaching out to a number of Republican legislators. We think we're going to get support on both sides of the aisle because, again, this is a modest proposal, a common sense proposal, and so we think it's a good standard.
I would just say more and more studies have been done recently. There was a study done, for example, by the Federal Office of Worker Safety, and not necessarily quoting that study, there have been additional state studies, but there's a fact here I think we should all know. Children with parents who have paid sick days are 13% more likely to receive vaccinations and preventive care. So this gets back to, again, the health of the family, because parents have to take time off to care for their sick children. If they don't have the time to take off, that child goes without seeing a doctor, or a sibling misses school and stays home with the child. But still, there's no visit to the doctor. this is a very compelling fact. I think we have to take this paid sick day proposal incredibly seriously and do everything we can to get it passed.
And just to correct the record, this year in 2019, the bill was actually laid on the table and was supposed to be turned into study. The money was part of the budget, but then it was taken away. So we are thankful that organizations like Virginia Interfaith and many more has taken on this issue and using their own resources to get the results and the support that we need.
So there was a bill in 2018.
And 2019.
And 2019, that's right. And so sometimes in the General Assembly, they say, oh, we like this bill, but we've not seen it before, so come back. So they've seen this before, so now's the year.
Yeah, it has with any sort of transformational piece of legislation, it always takes a couple cycles. We have to educate lawmakers, we have to make our case, it takes time to speak to 140 lawmakers. So I think it's a positive that this bill has been introduced
That's
before,
exactly.
and now it's
Exactly.
moving forward again.
Exactly right. Yes?
Do you happen to know how many other states have legislation requiring paid time off?
Yes, 11 states have paid time off standards. And again, those states are actually a lot like us. They're states that have either sort of split houses or they have a Republican governor and a Democratic House and Senate. And so they are like us. They're kind of a purple state. And so I think if they can do it, we can do it.
We will have a list of those 11 states in our pocket.
It's in the fact sheet.
Yeah.
And was your bill modeled on a specific one, or did you look at all of them and try?
With the Interfaith Council, you're part of a national umbrella. The Virginia Interfaith Council is part of a national umbrella group that brings together all interfaith councils around the country. So they have looked at best practices, and our bill is sort of a basic model of what has actually been adopted in those 11 other states. So we're very much interested in setting a similar standard across the states. Perhaps one day we'll get a national standard, but that really is our goal.
Any other questions? All right, well, we look forward to the support of everyone in this room. We look forward to working with our champions, and we again thank you for being such champions. We're going to be working with teachers around the state, and if you need some tissues, please take some. Thank you very much.
Could we have all of our speakers up front? And I'd like to take a picture with everyone. You guys can all look at preschool. All right.
Close to that, yeah.
Maybe we should all hold
Everybody
tissues.
hold up a box.
Okay, everybody gets to hold a box of tissues.
Oh, this is great.
If you like it.
Oh, there you go.
All right.
This is gonna move.
Actually,
We're gonna get
I'm gonna
some
have
of
you
our
like
candidates to testify.
Come in front of the Okay, perfect. Sorry, you're
So they can see our tissues.
And so we can see our
Special
message.
Yeah.
Okay.
We,
All right, everybody hold your tissues.
Hold
This
your
Have your
tissues.
tissues down.
And now maybe like take a tissue out. Ready? Take a tissue out. 1, 2, 3. Blow your nose. Thank you. We gotta have fun. Thank you so much.